Here's Bob and Mary. They have been married for 4 years. They want to start a family, but Bob has an extremely low sperm count. Aww. Bob and Mary go to a hospital. Bob asks to find a doctor. He is introduced to a doctor. Bob and Mary discuss their situation with the doctor, and Bob asks the doctor, "What is in vitro fertilization?" The doctor replies, "In vitro fertilization is a widely used technique that involves fertilizing the egg by sperm located outside the womb." Bob replies, "Wait, what's a womb? So does that mean that in vitro fertilization is a good process that I should use?" A womb is where the baby is held while it develops. And yes, I believe that you should take advantage of this process of in vitro fertilization so that you guys have a good chance of starting a family. Bob says, "Thanks. I'll discuss this with Mary when we get home. Thank you for your time." They get home, and Bob discusses with Mary. They decide that in vitro fertilization is the best way for them to start a new family. Before we decided on this, we decided that we would learn the steps of in vitro fertilization. The doctor smiles and says, "Sure. The first step is to assist in follicle growth. We will prescribe medication to you that may include gonal follicism, Brasso, Meopur, and/or Reprove injections used alone or in combination to stimulate egg development. Wait 8 to 14 weeks of treatment. When follicles are mature, receive injection of human chronic gonadotropin in order to begin the maturation of the egg. Mature eggs will be collected by ultrasound-guided needle aspiration. Once eggs are retrieved, doctors will use a microscope to isolate the eggs by placing them in a special culture where they will be for 2 to 3 hours. Sperm will be provided on the day of the egg retrieval and will be used during the fertilization process. Sperm and egg will be placed on the medium with each egg. Eggs will be examined for the first 18 hours to see if they have fertilized. If fertilized, eggs will be kept in an incubator for further development. Embryo picked up into a fine catheter and is inserted through the cervix into the uterus, and the embryo are placed within uterine cavity. And if all goes well, the lady will be impregnated. We have decided to go through with the process of in vitro fertilization. What do we have to get done in order to get it ASAP? Doctor says, "Just fill out the application and you guys are ready to go. Let me direct you to the room for the procedure." Mary and Bob talk about how excited they are because they will finally be starting a family. "Doctor, I must take your blood pressure, weight, height, etc." Bob says, "What is the percentage that in vitro fertilization will be successful?" The doctor replies, "Almost 94% of in vitro fertilized patients are able to start a family." Bob and Mary go together. "Okay, let's do this." And they have a baby. Beautiful.
End.